Hi, everyone, and welcome to our Young Timers Ask the Expert series, where we talk to experts about the unique topics and challenges that face the early onset familial Alzheimer's disease community. Today, we'll be talking to Dr. Bonnie Hennig-Trestman. Dr. Hennig-Trestman has a doctorate in social work and over 30 years of expertise providing and guiding clinical services to patients and families suffering from neurodegenerative diseases. She is an assistant professor at the Virginia Tech Carilion School of Medicine in the Department of Basic Science Education and the director of the Carilion Clinic Huntington's Disease Program. She authored the book Talking with Kids About Huntington's Disease, and her research focuses on developing effective strategies for parents to discuss and navigate a Huntington's disease risk and diagnosis with children. Thank you so much for joining us, Dr. Hennig-Trestman.
Thank you so much for inviting me.
So before we get into the questions, I just want to say Huntington's disease is obviously not early onset Alzheimer's, but there are similarities. It results in dementia and a debilitating disease in a person's 30s to 50s. They're both hereditary in an autosomal dominant fashion. So there's that 50% chance that children will inherit the disease from their parents. And given that there's so little information on appropriate ways to discuss this disease with children, we thought it would be really great to bring you in because of your decades of experience helping families navigate a Huntington's disease diagnosis and your continual support for children of affected parents. So thank you so much for joining us. And we look forward to hearing your recommendations on how we can apply what you've learned in Huntington's to the early onset disease community.
And I think it's great to be able to collaborate, to be able to share resources. I do want to remind your audience that my expertise is not in EOFAD, but as you said, I think that there are a lot of similarities and that people can use some of these to create tools in their tool chest.
Let's get started. So we often hear in the community that parents believe the best way of protecting their children is to shield them from knowledge that early onset familial Alzheimer's disease runs in the family. In your book, you state that in the beginning, this strategy appears to be beneficial, but is unfortunately detrimental to the child in the long run. And I'm just wondering, can you talk a little bit more about this and why it can be detrimental?
Yes, and I think it's so important. I think just to start off with, I just want to give some definitions. So I am going to use the term parent. That means a lot of different things in a lot of different families. So it could be a biological parent, it could be a step parent, it could be somebody who is a guardian, it could be aunts and uncles who are the primary caregiver, grandparents. So I am going to, just for the sake of time, use the word parents. And I think you're right, because, as parents, what we want to do is to protect our children. So when we have scary information or upsetting information, that's a knee-jerk reaction. We want to protect them from that. But that doesn't mean that that scary thing is going to go away. It's certainly going to be, especially when you have chronic illnesses such as HD and EOFAD in the family, it's there. It's going to be there. So when I say in the long run, it can be detrimental to the family, that's based on some of the research that I've done working now with young adults and adults of people who have grown up in families with Huntington's disease. Because basically what those people are saying is that they do feel robbed. The families that have not discussed at least Huntington's disease or other illnesses in their family, they feel that some of the choices that they made, even if they are making exactly the same choices, if they had that information, they feel that it just wasn't there for them. And then that it creates some trust issues. So all of a sudden they're like, what else hasn't been discussed in this family? What else are people keeping from me? So I think it's really important to be able to know that the young people who have now grown up, and some of the young people themselves, will say, I want my family to talk to me about this, even if it is upsetting. So I think that that's what I mean in terms of detrimental in the long run. All of a sudden now you've got to go back and recreate trust, which can be really hard to do. It's not impossible, but it can be really hard to do.
So we talked about, how it can be detrimental to hold off some of that important information about the disease in the family. I'm wondering, you talked a little bit about trust, but what are the benefits of talking to children about a hereditary disease like early onset familial Alzheimer's disease?
Yeah, and I'm glad you bring that up because there really are a lot of reasons. I think, first of all, knowing that if there's anything in the family that is going to happen that's going to impact a child, and in this situation, it certainly will, a child does have a right to know that. We have to remember that when we are talking to children about different things and we have some fears, which I might talk about later, is that fears are learned. So I think it's really about, how we have grown up and what's important to us and what has helped and hasn't helped when we have grown up. So I think it is really letting the child know that this is an important thing that's happening and you have a right to know. Also, I think it's important to know that when you're not talking about something in the family, as I mentioned before, then you're letting the child know that, maybe we can't trust you, maybe you can't trust us. And that's really difficult because it just sets this standard that you don't want to have to start discussing in a family just about trust. Also, know that especially little kids, even though diseases like Huntington's disease and EOFAD are really difficult, are really hard, that sometimes children actually have fears that are worse than the actual situation. They can come up with all kinds of things of why people aren't talking to them about things. So I think that that's really important to know. And when we don't talk about something that's going on, we are giving the message that it's too terrible of a topic to discuss. And yes, it is difficult. We're acknowledging all of that. But if we don't talk about it, this is, we're just not allowed to talk about this in our family. We never mention, nobody talks about this. That's a message that we don't necessarily want the child to have. And then also eventually that child is going to find out some way, shape, or form. I know when I talk to families about Huntington's disease, sometimes there's extended family. Now, even young kids are on social media, so they're connecting with cousins or they're connecting with somebody who might inadvertently talk about the disease in the family. Also, we're talking a lot about genetics in academic curriculum. So I have stories in my book talking to kids about HD, about a young woman a young child whose mother was going to talk to her about HD. And in biology class, they were talking about genetic illnesses, autosomal dominant genetic illnesses. And, this is something that she went home that night and said, is this what dad has? And, it wasn't impossible, but it just made it a little bit harder because that mother was going to talk to her child, but somebody took that control away. So I think it's really important to know that, we want to have that control. We want to be able to figure out when it's the best to tell the child. And when we do have families that openly discuss the illness, another thing is that you don't have to figure out what you've told them and what you haven't. And I really hate using that word lie, but because sometimes it's a white lie. And again, it's to protect, but you don't have to think back of what do they know? What have I told them? What has somebody else told them? Because that takes a lot of energy that we just might not have that energy. Also, it's really important for families to know that children really can be resilient. I know we'll talk hopefully a little bit about that later on, but I think that it's important to know that children can cope with difficult situations if they too have the tools to do that. And they're going to do that in life. And we'd love to be able to protect them throughout their whole lives, but they're going to be difficult situations. So I think knowing that they're resilient can be helpful. And again, as I talked about, fears are learned. So it's really the presentation. So when we're talking to children and making things normal, that can really be helpful. It doesn't have to be something that's really scary. And also that children who have been told have an explanation for some behavior that they might see. Again, they might think that their fears might be worse than what is actually happening, but then also they'll have an explanation that a lot of times in families with HD, we can say, well, that's the HD. She didn't mean that. Or, then we all of a sudden, we don't need to fear that child doesn't need to fear the person with the illness. Because when we're thinking about, that's the scary grandma, or that's the mean uncle, or, my mom is always in a bad mood, to say she can't help it. So it gives us an explanation which can really be helpful for a child.
Those are such important points, and I think they really will resonate a lot with some of the I think actually everyone in our community as well. All of those things you talked about, yes, especially I think knowing that it's not your parent, it's the disease. I think it's just so important to know and remember and think about when you're going through that struggling with some of the symptoms that come up. So we talked about, the benefits. Let's say a family has now decided, you know what, it's time to talk to the kids. I guess what I want to get into more is the nitty gritty recommendations that you have for doing this, because I'm sure this can seem very daunting to parents, and they want to maybe do it in the most perfect way, disclose the information in the most perfect way. One person wrote in, we want to safeguard the child as much as possible, but mechanisms for achieving this depend on the individual child. It depends on the parents, it depends on the family, it depends on the situation. So are there ways to determine what is best for a specific child? And so can you give us some of your recommendations for, again, creating this perfect way of disclosing this information?
Yeah, perfect is a hard word. I wish there was a perfect solution. I wish there was a magic wand. And it really is. Whoever wrote that in, is wise to say and to know that each situation is different and each situation is unique. So there really is no perfect solution, but maybe again, I can give some tools. I think, first of all, it really is based on the way that this family communicates. And I'll give you some examples of that. I'll kind of run down some things. The first thing I want to do, though, is to really encourage the parents. Again, I'm using that term, very loosely and generalized, that you want to look at the ways that you were told about this illness when you were growing up, because that's going to communicate through. I think it's really important. We tell this to families with Huntington's disease all the time. You've got to look at that. If you want to break the cycle, you've got to look and see what was helpful when you were growing up, what wasn't helpful, what was really difficult, what didn't work. And base your conversations off of that. Because if you have a lot of anger and if you have a lot of resentment, then it really is helpful for you to get some help and some counseling to work that through, because you want to break the cycle and you want to, which I think is fantastic, and you want to be able to come to this table with a child and be able to have a conversation that it doesn't bring up all the emotions that you went through when you were a child or a young adult. So I think that that's number one. I think that also in terms of maybe the person who talks to the child really should be somebody that they trust. Also, as I say to families who are dealing with Huntington's disease, make sure it's not somebody who's going to sugarcoat things. You're never going to get this, or don't worry, or this is going to go away, or we want to, again, do that, as this person was saying, that we want to safeguard. But then there's the reality that this illness is there and right now doesn't really have a cure. So I think it's really a question of figuring out who that child trusts and who can give them the best information. Now, for some families and in the community, in the EOFAD community, you might have some really good experts out there that somebody could say, well, I want you to come to the clinic with me. I want to take this child to the clinic. And that happens all the time with the families I work with. But again, I give them a caveat to say, number one, they don't know who I am. They don't know where you're going to be taking them. So I think it's really about giving a couple of sentences, just a few words that will say, this is where mom or dad is going, and giving them just even the name, however you want to call this, EOFAD, early onset, Alzheimer's disease.
Diet. Yeah. Mm-hmm.
Just diet, any of those things, just so it's something common that the child at least knows, because it's scary meeting new people. Even if they're nice people, it can be really scary. Sometimes what happens in my clinic is I just tell people, just bring your child along. The exams that I do are not where people are taking off their clothes and very invasive kinds of things. I'm talking to people, and having a child there, or even just me sitting on the floor and drawing pictures or playing with Play-Doh, then saying, remember Dr. Bonnie, and she wants to talk to you now about what's going on with mom or dad or whoever it is, or the parent. So I think that can be really helpful, just to think, who is that person who is the trustworthy person. People also say to me, when should I tell them? And in my book, I do talk about that it's never too early or too late. And I think it's really important to know that it's easier to put off the conversation and to say, well, I'm going to do it next month or next week. Okay, certainly if, the day that you find out information is your birthday or the child's birthday, or, the day before a holiday or something special, maybe you want to let it go for a couple of days. But please do know that the more you put it off, the anticipation is it grows. It gets much, much worse than actually having the conversation. So I think it's really important to be able to say, make a date and make it soon so that you can say, I need to have the child come and be with me and not be someplace else or have to run off to, an event or something that they're doing. So I think that that's really important. A lot of times people will also ask about, where should I do this? And again, we go back to like the basics. Where do you have most of those conversations? There are families I know that go on hikes. That's how they have their talk. There are families that sit around a table and do a puzzle or play a game, and that's where they talk. Sometimes just sitting down and being able to draw some pictures or, like I said, play with Play-Doh. The reason I bring that up is it's a lot easier to be doing something with your hands and not sometimes locking eyes, even if you're a parent, even if you're a loving, wonderful parent. It's just sometimes easier when you are playing with something or drawing something. And then a lot of times that conversation can flow. I do that a lot in my office with young people. It's just sort of a distraction thing. And it just allows a safe place. But you've got to know as a family when you have your conversations. Obviously, you don't want to be like, okay, I've got 15 minutes and I'm running out the door. I'm gonna talk to the child about this. You want to have some time. It doesn't mean you have to sit there for hours and hours, but you don't want to do things that are rushed. Also, I do tell people, maybe not right before bed. If you're talking about something important like this and then click, the lights go out, that child's head is going to be spinning, whether they feel like you've answered all the questions or not. So I really say to people, that can be kind of a scary time of the day for parents anyway, and for children anyway. So I think that that's really important to make sure that it is a time where you can come back during the day and that child can sort of come down from some of that information that might be upsetting to them or might be just matter of fact, but then they're going to be thinking about a lot of things. And then people say, well, how do I do this? What are the words? And I say, just keep it basic. Just something like mom or dad went to the doctor, and now we know why some of those things have been happening, why he, acts this way or moves this way or thinks this way. So you really have to, you really can start off very, very slow and just basic information just to open up the door. And once you do that, I think then it's a lot easier to come back together and start talking about some of these things. Couple of other points that people do mention is that in terms of talking to one child or all the children together, and I do have families that the age ranges and the number of children are vast. Sometimes it's over a decade from the firstborn to the lastborn. But I really do think it is important for all the children to have basic information together, even if that's working, having an infant or a child in your hand and talking to a child that's older. You want to give this message that everybody in the family is important and that everyone is going to have this information. And I think we're going to talk a little bit about this later, but especially when someone says, well, I told the older kid, or I told this child because for X, Y, or Z reason. And I want to at least let people think about the reasons why that might not be such a good idea. And that is because of burden. So when you say to one child, I'm going to tell you, but I don't want you to tell, one of two things can happen. One is that child says, I've got this burden. I'm not supposed to tell anybody. And, it might be scary, actually. It might truly be a burden on this child to say, I can't slip up. I'm not supposed to tell. They're asking questions or, I'm just not supposed to tell. All of a sudden, it's that kind of burden. Or they're going to turn to the other children and say, I'm going to tell you something, but now you can't tell mom or dad that I told you. Then we have another layer of secrets. So I think it's really important to sit down and make sure that all children do have some level of information, or at least that we're using this term. I think that can be helpful. And again, I think it can be really helpful just to, in terms of finding out the perfect way or what works in your family, is to ask people. And like I tell people, even about their news, get it from lots of sources. So you might want to talk to a professional who has, knowledge about Alzheimer's disease. You might want to talk to a child developmental specialist. You might want to talk to adults or young adults who have grown up in families very similar, who have EOFAD, just to see what worked for them when they were growing up. What do they wish was different? And sometimes just, people in your family to say what worked and what didn't work. So get information from lots of different places, different sources. Then you can make up your mind in terms of how you want to do this.
So my big takeaway from this is that it best comes from the parent almost, or the parents together. And that
Right.
it maybe is at a place where, let's say, usually at dinner, they always have these conversations, or at the dinner table, and then telling everybody in the family all at once, kind of very basic information, and then later age appropriate. And I just say that because right now, I do want to get into that topic, because we hear a lot about talking to children about, let's say sex as a topic. You want to provide it in an age-related manner. We also hear this about that's how you should talk to children about disease. So I'm wondering if you can expand on this and what your recommendations are for parents who have young children, so between the ages of 2 and 5, versus older children, so 5 to 11, versus teenagers. And I think I might even include young adults, like 20 to 25, because sometimes the onset is a little bit later for EOFAD. There is a lot of teens, that parents become symptomatic, but definitely as young adults. And so I think it might be even good to know, how to bring these conversations up in an age appropriate manner for them.
Yeah, that's a great question. And again, these are generalizations. So the two things I want people to think about are certainly the age. You are going to talk to a toddler very different than you're going to talk to a teen or a young adult. But then there's also that level of understanding, because I have talked to some 10-year-olds who know a lot about, again, in my situation, Huntington's disease, and talking to the community about Huntington's disease. So I think you do need to step back and figure out developmentally wise, how much they can understand. But so these are going to be generalizations. So this was sort of the caveat. Certainly when we're talking about infants and any, infants up to, let's say, even toddlers of 2 years of age, obviously they're not going to understand these words, but you can still feel comfortable talking about this topic, talking about Alzheimer's, and using these terms and these words, whatever's comfortable in your family, that will explain, and you can talk about this in front of them. But my suggestion is to use a soothing voice when you're around them, even when you're not talking about this, they're going to pick up on your affect. So anything in terms of not arguing in front of them and not being overly emotional in terms of what's going on in a certain situation. But once you find out more information about yourself or your loved one, and then being able to openly and honestly talk about this in front of them, again, gives the feeling that this is something that this family is coping with and dealing with. And certainly, and with all these ages, giving lots of hugs. There's definitely, just in terms of child developmental, some of these people who are saying, well, you don't pick up the baby all the time because you don't want them to get dependent on you. Babies are dependent on us. Babies and toddlers are dependent on us. So in my feeling is, especially when there's situations in terms of chronic illness or any type of thing like this that's going on, they're going to need more reassurance to say everything is okay. And I think that that's really important. When you have children who are, let's say, 2 to 5 years old, know that it is really common for them to have anxiety over things, that this is sort of that age that they're having the nightmares and that they're worried about some stuff. They might not be able to verbalize it, but they're always going to want to check in to make sure you're behind them or that you're watching, where the kid says, look at me, that's really that connection, that attachment that's going on. And I think it's really important to make sure, no matter what's going on, if you can, and I know that people need resources to do this, to try to keep your routine as normal as possible. So if there are things going on for that child and they're having some anxiety, it really is very comforting. It's comforting for all of us to have a routine, but just really going over that routine and letting them know that that everything, today, this is what we're doing, tomorrow, this is what we do, and it's that same routine. It's also really important for parents to know that children, especially that 4 to 5 age range, they think they have these magical powers. So they don't understand death. They don't understand disease so much, but they think that if they say something or do something, that's going to cause something to happen. And we've all been, in a situation that either we've been the parent or maybe even the child, or we've been in a store where we've heard that kid say, I hate you. You're the worst mommy. I wish you died. So it's really very important to make sure that this child, once you do talk to them, knows that there's nothing that they've done to cause this. Even if you've been mad at mom or dad, that your words can't make somebody sick. That's really, really important. Even if your child hasn't brought that up, I think it's really important that people talk about that, because that's really a developmental thing. When children are a little bit older, 5 to 11, a lot of times they're overly concerned about health, and they worry a lot about, things that are going into their body and coming out of their body and what's going on. So I think for that age group, it's really important to keep them informed, but maybe it's that conversation after. Hey, I just want to let you know, I went to the doctor and we talked about my EOFAD, and, it looks like everything's pretty normal and that things haven't changed much. Or if they have, just give them a little bit of information that, now I'm going to be doing something different, but I'll keep telling you about it, and just reassuring them and not giving them, detailed information about things. Also, what you might, because I can't help it, you might hear me say, even to you, did that answer your question? So a lot of times I will, if I'm at a conference or even with staff, when someone asks me something, I have an idea in my mind what they're asking, and I give information. But then if I step back and say, did that answer your question? Then that person can say, oh, yes, or, well, that's not really what I was asking. So I think just stopping and making sure that you do check in, with all these age groups is really important. Also, that 5 to 11 is when the kids are starting, in terms of, especially a little bit of the older side of that, going to school. And if you have a good relationship with school, I think it can be really helpful to at least let the school know that there's some illness in the family. Again, I speak to the community, the HT community, and there is a lot of stigma in terms of Huntington's disease and not openly talking about that to a lot of other people. But certainly letting the family at least know that somebody is ill in the family, so that if there are any behavioral changes or any academic changes or not hitting milestones, that you have a relationship with somebody at the school who can give you some feedback. And a lot of times, believe it or not, even if there are some behavioral changes at home for the child, at school, because that routine is, because their environment is so routine, is so structured, they might not have any kind of issues going on there. But I think it could be really helpful just to check in. I think also, when we're talking about a little bit older, those tweens and the teenagers, know that they are prone to mood swings and anxiety and depression, totally aside from any illnesses in their family. And at least with Huntington's disease, when we talk about anxiety, depression, agitation, being withdrawn, all of a sudden there's this, oh my gosh, is that a symptom of Huntington's disease? And I have a feeling that this also goes for FAD, also be just saying, well, if I have, the same thing that my parent has, anxiety or depression, or if I'm irritable, is that something that's happening in myself? And certainly letting them know that, that we all have bad days, and that it probably isn't. I mean, we do have a juvenile onset Huntington's disease in our community. So we do need to be in tune to that. But a lot of times, but it is anxiety and depression that's pretty typical in families that have illness, as well as in certain age groups like teenagers. And again, with teenagers, they're trying to do that push and pull of being independent and dependent. So it's a lot of times I do get families say, they're really withdrawing. I'm talking about, something, and they get really angry or they get really withdrawn. And yes, that is common and typical. But I really suggest to people, it's not a question of you forcing somebody to talk, but you want to provide information. And some of the research that I've done on early onset Alzheimer's disease, I know it's not a lot, but there is some information out there. And I think really being able to say, here's some information for you to look over, or here's something for you to read on your own time is really important. And then making sure that you come back and you check in and say, so, I don't know if you had a chance to ask, to read the information or to watch the video, but I want to know if you have any questions, because anything we give to them is going to be a supplement to that conversation, not a substitution for it. And I think it's also in terms of like you said, adults. I think you need to look at where that person is. And there's always going to be times, again, where we're going to say, well, they're just, they're trying to get into college, or they're finishing up college, or they're in a relationship now, so I don't want to say anything. But again, and know that it's never too early, but it's never too late. That really making sure that you have open and honest conversation with adults, especially if they're going off, to school, or if they're finishing up and starting off on life on their own, just to be able to say, I want to make sure that we have this conversation. I don't want to overburden you, but please know in advance that I might come back and just check in with you. And that's my way of coping with this. So when I do that, I know that might be a lot for you, but just know that that's my way of just making sure that we're all doing okay and that we're getting support. I don't want to force things on you. And again, even with adults, as I said, just if there are questions, saying, did that answer your question? And just making sure that you come back to these conversations every once in a while. Again, these are just little tiny smatterings of some age categories and groups and what we can do. But I think it can be helpful just to know, where to start when you have children in those categories and those age ranges.
No, that's extremely helpful information. So I just want to talk about how there are different levels of information to give, that this disease runs in the family is very different than a parent, was tested and has the mutation versus, a parent is just at risk. And then also, disclosing that children might also be at risk. I mean, those are all very different levels. So
yeah.
I had a follow-up question and I want to read that now. And then maybe we can talk about how you disclose some of this very different, levels of information.
Yeah.
This person writes, I'm nervous about when they question us about runs in the family with Alzheimer's. They're bright kids, and we always talk openly about everything in life and answer every question with age-appropriate information, just not sure when to drop the bomb that they could have this gene 2 mutation. We don't want to freak them out, but we don't want it to be hidden.
Yeah. So this is great because this is on the one side of a family who's really open with this. And I think, again, that's awesome. If these are not even teenagers, my gosh, even if these are younger children, chances are that they've looked this up on the internet. I've worked with so many parents who have been in this situation. Again, it's Huntington's disease, who have said, we talk openly, they see their parent with Huntington's disease, but I'm petrified. And I'm thinking about a family that I work with, probably 15 years ago, where mom had Huntington's disease and was symptomatic. And the father was like, I just can't tell him. I just can't tell him. And finally, after many months, he said, I want to bring them in. And they know, of you, they know who you are. They know of Huntington's disease. So I sat them down, and it was the dad and the 2 children. And they were, preteens, I think. And again, this was 15 years ago. And I said, well, as I do with everyone, tell me what you know about Huntington's disease. Again, that's the disease that I work with. And right within the first 2 sentences, it was like, well, it's a brain disease and that it's genetic and I have a 50% chance of getting this. And the dad's eyes were like deer in the headlights. He's like, wait, what? And they were like, yeah, we looked all this stuff up. So chances are, if you are a family that has openly discussed this or used some of these terms, my guess is, even if you told these children not to, they've looked this information up. So don't be surprised about that. It might be just about, hey, checking in and seeing, what you know so far, or what questions you have so far. Or what I do, which is a little easier because I'm not part of the family, that I say to a child, if I was an alien that came down from outer space and I had no idea of the term Huntington's disease, what would you tell me about it? So I think, first of all, really finding out what the child knows, because I think that will help to understand what they've heard so far or what they're assuming. Now, this family who did write this said something really interesting. And I'm a therapist, and I kind of look, I hear what I'm hearing, I take apart. You said, drop the bomb. And that to me really says that, and it does feel like that. I get that. I understand that. But my suggestion is to try to reword that. And just to make this normal, because there are so many different illnesses, there are so many different things that our genes that can do and might do in the future, that instead of dropping the bomb, just being able to normalize this and say, this is in families. And sometimes I even have some families draw a family tree so that there are people you can see, here's where at least we know that it started. It probably started well before that, but here are, the people in the family, so that the children know that this is a familial disease. And then being able to say, you have as much of a chance of not getting this illness as you do getting this. So we just don't know what the odds are, but also being able to buffer it a little bit by saying the truth, which I pretty much believe is also in the EOFAD community, is that every day the scientists and researchers are looking for not just treatment of symptoms, but treatment of the disease and trying to find cures. So our hope is that by the time this might become an issue that we have to think about for you, that there's going to be other things out there that can really help. So again, the first thing is about your experience and maybe trying to reword. Don't feel like it's dropping the bomb, but just trying to make something very normal in the family that really happens. Other genetic illnesses or different things can happen in different families. So I hope that helps out a little bit in terms of maybe framing that.
Yeah, definitely. I think so. And I think it's so important. It is to buffer it, and especially in our community, because we actually got some really exciting results this year from a clinical trial. So there's a lot of hope right now in our community.
And leave every conversation with hope. I do that with adults as well. Whoever comes in my office, I let them know about that. And if people know about the HD community, we've had some opposite. We've had some clinical trials that didn't go so well. So we are, though, saying that there are still lots of pharmaceutical companies, researchers, and scientists who are looking at other ways to treat this disease. So I think that that's great, really encouraging people to make sure that they're up on the research and talk about that with their children.
A second follow-up I wanted to bring up is another question we got from the community. And this person writes, I guess it's also like sex talks. You are led by their questioning at their pace. But what happens when their pace is slower than progression of a parent's or family member's decline?
Yeah, so this is a little bit kind of on the opposite. Opposite would really be a family that never talks about this. So this is also great because this family, the parents are taking the cues from their children, which I think is fantastic. And I think sometimes, that the child, it's not that they're not curious, but they don't want us to worry as parents. So they don't want to overburden us or ask too many questions or make us feel sad. So I think number one is really making sure that the children know, that saying to a child, well, you didn't seem to have a lot of questions or you didn't seem to have a lot of concerns, which is fine. But I want to let you know that I did have questions and I did have some concerns. And I found out that asking that, even if I didn't really want to think about it because it was upsetting, or if I had to ask somebody I really care about and I didn't want to upset them, that when I did ask those questions, I got some of my answers. Now, not every question can have an answer, because sometimes it's about the future and we just don't know what's going to happen in the future. But being able to say that I asked questions and I got my answer, and it was so nice to be able to do that, even if it's something sad. That crying doesn't mean that that you're bad or that you're not brave or that you don't have courage. That those are really important when you're sad about something, that we can all be sad together. Actually, sometimes having a good cry is good together, and getting a good hug afterwards or feeling supported. So I think that if being able to say that you can always come to me and ask me questions. So that's the first part, in case they do have questions but don't want to upset. The next is being able to say, okay, you didn't have any questions, and that's fine. but things are changing a little bit. So I want to give you a brief update of what's going on. So now, dad's not really able to drive anymore. So as sad as that might be, I need to let you know that you can't keep asking him for a ride, or that we're going to try to figure out ways that we can get your needs met by getting to school, getting to your after school activities, getting to the store, going to, out shopping, getting whatever you need. We're going to get our food. So I want to make sure you know that we're working on taking care of that, and just giving a brief update about what's going on, and then seeing if the child or children have other questions about that. So I don't think it's just taking cues, and if they don't ask questions, you stop there. Sometimes you have to push a little bit just to say, let me just give you a brief update, and hopefully that helped that family just put another tool in their toolkit.
I've heard this from a couple of different parents. So they are worried because their child has been diagnosed or experiences increased anxiety or depression, and they don't want to add to that. So they're very worried about discussing the disease with them and adding to an already kind of emotional burden that this child is already feeling. So what are your recommendations in those cases?
Yeah, no, and I do get this a lot. And I think, number one, it's because people are growing up in families with Huntington's disease. And my guess is that that's very similar in terms of EOFAD, that it can be traumatic. It can be really difficult. It looks different than other people's families. So I think just knowing that just because a child does have a diagnosis, or you think that they have a diagnosis of anxiety, depression, or other mental health illnesses or health illnesses, doesn't necessarily mean that you shouldn't talk to them about upsetting and sad things. I think that sometimes it can be really helpful because, number one, a lot of times children who do have a formal diagnosis will have a whole team as well of people. And there's lots of eyes on that child that you can say, all right, we need to give you some information. Again, it's about you're important in this family. And even if you're really open, which would be my suggestion, saying, I know you worry about things once in a while, or I know that you get anxious about things once in a while, but that doesn't mean I shouldn't tell you things. So we're going to try to go at your pace. I want you to know everything is okay today. Right now, everyone's grounded. Everyone is okay. Things might change in the future, but I'm going to tell you about it so that you don't need to worry. Or if you have concerns, come back to me and we'll try to figure this out together. This is really important that we have more communication than less communication. Then, as I said, a lot of times these children do have a therapist or a pediatrician or a neurologist or someone, a school social worker or someone in the community that they're seeing. Let them know as well so that they can have the opportunity to talk to this child about it. Again, our knee-jerk reaction is, my kid's anxious, my kid's a worrier, I'm going to shut down, I'm not going to tell them about this. A lot of times it's because that child feels that nobody is talking to them. Not always, because I know that there's the brain and there's all stuff going on. But if we can control the environment and say and reassure that child, even when things are sad in this family or upsetting, you have a right to know. And if it's too much, we're going to work with you on this. But I really do. I work with these kids all the time in like our HD camps. I've been a staff member at the HTO North America camps prior to COVID, 5 years in a row. And people will, we work with 50 kids from around the United States and Canada who come to our camps for 4 days. And we have kids who the parent has said they're a worrier, they're anxious. And these kids blossom there because they're around people who get it and they're talking about this, but not overly talking about it. And if they have to step away, they step away. And as trained people, we want to make sure that if someone's really having a hard time, that we give them a chance to do their breathing exercises, or we talk to them about breathing exercises and how that can help to calm them down a little bit. And again, if a child's working with a team, they might have this tool chest as well that they might be able to pull out things of saying, I just need to breathe. But just again, knowing that they are worthy to talk about these issues and that they feel that self-worth, that they're part of this family, and knowing that in a family that even if you worry, we can support each other, that we can talk about issues and support each other. Really, I really do want these families to think about, even though they have labeled, somebody as a worrier or anxious or depressed, that doesn't necessarily mean they're going to take this information and go harm themselves. I think letting that child know, I'm concerned, but I know that you have a right to know this as well, I think is a good balance. And again, I'm going to check back in with you and see how you're doing and see if you're concerned about anything. I think that that's a good way to start breaching this subject with them.
Yeah, I totally agree. I think, saying that you're able to hold space for their sadness and even, talk about things that are sad, that's maybe even what they need,
Yes. Yes.
So we're going to shift back to talking about talking to the kids and and different situations that people maybe in. So I've sometimes heard that parents are actually on different pages about whether they should actually disclose the disease in the family, whether they should disclose that the parent's been tested and is positive. And one parent is kind of ready to tell them and the other one not. So what's your experience in navigating that situation?
Yes. And again, in the HD community, we do have this that comes up where families are torn between wanting and not wanting to talk about this. And it could be difficult. I think, again, having the conversation, we're going to call it two parents, two moms, two dads, mother and father, whoever it is, being able to say to that person, I understand this is difficult. And I understand this is not a topic that you want to talk about. And it could be for some guilt, it could be embarrassing, it could be sad, but this is our reality. And here's the cards that we're dealt. And I think that it's really time that we are going to include our children on this, and letting that parent know that this is based on research, on really being able to openly talk about these situations in the family in the long run really does benefit this whole family. So a lot of times what I do is say to the person who's willing to talk about this, talk to your loved one, explain this, that this is based in research, that it doesn't change our reality by not talking about this. It will make it normal. It will make it less scary for their child so that they know what's going on with you when you do have changes, or whenever you feel that it's right to be able to do this. And again, there's no perfect answer in terms of if someone's at risk, if someone has been tested positive, if someone is symptomatic, but then being able to say, I'm going to give you a choice. I'm going to either do this by myself, which isn't really the one I want to do, but I'm willing to do that. I understand either it's too difficult for you or you just really feel against this. Or I can do this with you. And you can just sit there, you can have your head down, you can cry, you can be stone-faced, or you can be really engaged. I don't care. But I want to let that child know that I've talked to you, and whatever your decision was, that you're willing to, the dad wanted me to talk to you first. He's okay with you talking about this, or maybe you just want to go over and give him a hug, that he doesn't want to talk about it right now, but he'd be okay. Maybe if you say, Daddy, can I just give you a hug right now? So that, that we know that the conversation has happened. But being able to give that person who is a little bit more resistant, there's a reason why. It's not just, I don't want to talk about it. There's a reason. And if you can peel back the layers, sometimes you can see the reason and address it. But just letting them know that I'd really love for you to be part of this. But if you can't, I understand, but I want to let you know up front that I'm doing this. Because you don't want to say, oh, I promise I'm not going to tell the kids about it, and then go around and tell them and then say, but don't tell dad. There's the layers of lying and mistrust. So I think that really just being able to understand what the reason is first, maybe trying to address that, maybe with a healthcare professional, I think that can be helpful. And then saying, here's your control. You can do this with me, or you can do it without me. And I'll certainly let the child know that I've told you that I'm going to be doing this, that it's just really hard for dad right now. Or for some reason, he just, he felt that he can't talk about this right now, but we can do other things. You can write a card or a poem or sing him a song or just give him a hug. That might be a really good way of at least starting to address this. And my guess is once this is out in the open, it'll be a little easier to be able to start talking about this as a family with everybody included.
So we talked about, we covered a lot about how to talk to kids. And now just let's say we've talked to the kids about it, and now we want to know, how can we best help children cope with this disease and that it runs in the family, and how this changes as a parent gets closer to symptom onset. A lot of people, I just thinking of one situation, one parent is maybe a year out from symptom onset. They haven't told the kids it even runs in the family. And one parent is saying, is it better to give the child the most normal life as long as possible, or give them time to prepare for the diagnosis? Again, how are we just best shaping this, let's say we've talked to them, but then helping them cope with the disease, that's in the family.
Yeah. And the term normal is so hard, right? Because our normal is going to be whatever's going on in the family at that time. That's what the normal is. It's a new normal. And I think that when we think about normal, it's comparing ourselves to other families who look picture perfect. And a lot of times that doesn't happen. But, let's take the family that we've touched on, EOFAD, and again, my guess is that the child has looked up some information. And when that does happen, know that a lot of times people and families are symptom seeking, not seeking out symptoms, but looking at themselves going, do I have that symptom? Or I'm looking at my mom or dad. Was that a symptom of Alzheimer's disease? It's really, really normal to do that. So if we say to everybody, everyone in the family that this is common, that this is something definitely that happens in families, and just because mom tripped or yelled at you for something or forgot your name doesn't mean that that's Alzheimer's disease. That's the start of it. It might just mean that she's just having a bad day, just the way you are. It might be she didn't get sleep. She's thinking about a lot of things. She is hungry. So she's, irritable, like hangry, we call it. So, letting children know, especially in themselves, because again, they might start saying, oh my gosh, I now know the symptoms of Alzheimer's disease. Is this what's happening to me? And a lot of times, even with the Huntington's disease population, we say, probably not. Even if you had the gene and it was showing a little bit later on, my guess is it's probably not. Again, we have juvenile onset Huntington's disease, so that's a little different. But most of the time, it's going to be that you're just having a bad day. So again, checking in every once in a while to say, let's keep you updated. So we talked about this a while ago, and now, it's a year later, it's 6 months later, and, everything's pretty much the same, or we notice that mom is having a little bit more difficulty. That might be because of Alzheimer's. So we're going to check in with the doctor to see if that's what's going on. And, maybe there's something else that you saw that would be helpful for me to know. But again, I think that children, no matter the ages really, are going to pick up on some of the differences that are going on. And that's normal. So it's not that you don't want to talk about it, is you just want to check in and update. I don't know if you've noticed that she's forgetful more or she's irritable more. We're going to check in with the doctor to see what's going on. So it's not about having that initial conversation and just dumping all of this information onto a child or an adult, to tell you, to be honest, but just to be able to say, okay, this is what's happening now. And, we're really hopeful because of this new information that's coming out in terms of some of the research, or, I've tested and now here's the information I have. I do have this gene, and what's that going to mean for me? Right now I'm okay, but maybe in a year, 2 years, 3 years, things might look a little different. And I'm just going to keep you updated. The take-home message is communication, not all at once, but just being able to feed some small information and checking in again. Do you have any questions? Do you have any concerns? If you don't, that's fine, but I'm going to update you. And again, it's not like an every single day check-in. Think about your emails. When you get something once in a while, once a month or once every 2 months, you pay attention. But when you start getting things every single day and it bombards you, if you're seeking it, that's fine. If you want information and you're trying to get all that, but when it just comes to you unsolicited, all of a sudden it gets a little overwhelming and you start shutting off. So I think that that's really a good analogy to use for kids, that you want to be able to check in with them, see what concerns they have, update them when there's new information, and then be able to say, I'm going to check back maybe in another week or so to see if you have any questions about that.
I love that analogy with the email, because it's so true. Yeah. Okay, we have 2 questions left. We'll see how if we can get through them.
Yeah, sure.
Your book was revised in 2017. Do you have any of the recommendations contained in that book changed since the last revision?
So not the recommendations, but in the last 2 years, we've had COVID. So I think really making sure that we are checking in because so many people are isolated and kids, maybe they are back in school or people are back at college or back at their jobs. That's great. But things are looking different and people are interacting differently. So I think it really is not so much the recommendation, but just making sure that there is some type of socialization. And again, it doesn't mean you have a party of 100 people. It means, checking in, whether it be by Zoom, whether it's, one-on-one, making sure that people have up-to-date information about COVID. So one of the things that is very different with people who have Huntington's disease is all of a sudden, is it safe for me to get a vaccine, to be vaccinated? And I think that that's really important to check with the healthcare community. It certainly is in the HD community that we definitely, especially people who are a little bit more compromised, who have more advanced Huntington's disease, it is even more important for them to be vaccinated. And then also explain to them why it is, why it's different to be able to interact with people because they can be so isolated. And I think that that's really important. So again, the big thing is that we want to make sure basic needs are met, but also that people have the correct information about vaccinations and correct information in terms of COVID, making sure that they understand how that can impact them a little bit differently and why it is so important to wear a mask and to be vaccinated, and just checking in with your healthcare providers on all of that. So that's been certainly a big difference, and working with kids to really try to reach out and connect them with support systems. It's a little bit more of a challenge now. A lot of our in-person conferences have been canceled or are virtual, and really trying to re-engage the community to say, we still need to be connected. Let's figure out ways to do that. So that's been certainly a big change since the book revision.
Most definitely. Actually, it just gives me an opportunity to say that Young Timers is looking to actually start a teen support group. So if there's anybody who's listening and who has a teen that might be interested in that, then they can contact us at Young Timers. Okay, this is our last question. And this was written in by somebody from the community. And I know, again, your expertise is Huntington's disease, so maybe we can answer this together. Given the differences between early onset familial Alzheimer's disease and Huntington's disease, what, if any, of your recommendations in the book might be modified for this population?
I think based on what you just said, in terms of some of the information about the research, there are so many similarities. And certainly, somebody who's an expert like you would be able to talk more about that. But I think that, from what I've read, certainly early treatment is a little bit is better in terms of amyloid and tau accumulating in the brain. So there are certain things when you talk about this and you get somebody in for treatment earlier. For Huntington's disease, it is about symptom management right now. And it's not, we've got to get you in early so that we have a better chance of reducing something. So that is a difference. It might not be what the person is thinking about, but also just in terms of really keeping people updated on research. One of the highlights of our camps is when the researchers, a lot of them are in the HD community themselves and identify as that, being able to say, I have this gene, but I'm in a lab and testing, mice, which is really cool for some of these young people to say, wow, you have this gene, but you're right in the thick of things in terms of research. Is when, people do come in and say, let me, in layman's terms, give you information about research and treatments and what's happening in the scientific world. So again, it's a little different in terms of recommendations and all of that, but that's, these diseases are sort of cousins of each other. People say, I'm not really sure what that means, but I understand it's a brain disease and there are a lot of similarities. Mm-hmm. So I think being able to take the resources, just like when you reached out to me, being able to take these resources and say, how can I adapt them? A lot of times it's really just changing the name of the disease. But I think that if people do look up resources that are already out there for talking to kids about cancer, I understand it's a little different, it's genetic, some cancers are, but Huntington's disease especially, because we do have resources that are out there. HDO, the Huntington's Disease Youth Organization, is an organization designed for young people up to 35 years of age, and looking at those resources. Again, it's a little different in terms of the disease, but there are a lot of tools that you can take out and put into your tool chest. So I think that there's more similarities than there are differences.
I would totally agree with that. I think a lot of the things that you said really resonated with me, and I think it'll resonate with the rest of the community. So, I just want to say thank you so much, Dr. Hennig-Trestman, for taking the time to discuss all of these important recommendations. I know it can be really daunting for a lot of parents and families to bring up this disease. And so it's just, I can't say how incredible grateful we are for you taking the time to make this at least a little bit easier and just take a little bit of that burden off some of the parents and families right now who are facing this.
And I'm absolutely honored that you reached out. Please, with the parents out there, know that you're not alone. You have tools. It's not going to be perfect. You're going to feel like you made mistakes. You can always correct them. You can always go back and say, I think the information I gave you wasn't 100%. You can go back, but reach out to each other. The parents that connect in the Huntington's disease community and the kids who connect really have so many people that they can call on for support. So know that you're not alone. That's my hope in terms of this collaboration. So I am honored to be asked. And I do hope that I've been able to give some people some more resources that they can take. And this is their jumping off point to say, okay, now I got some information. And hopefully they'll be able to go forward and use some of those tools.
I think they definitely will.
Great.
Thank you so much.
You're welcome.